Greetings of the day, everyone. I'm privileged to welcome you all in the Health Talk series organized by Student Council of Sadabai Raisuni Women's College, supported by SGR Knowledge Foundation and powered by Raisuni Group of Institutions. Bones. Bones provide support for our bodies and help form a shape. Although they are very light, bones are strong enough to support our entire weight. Bones also protect the body's organs. But what if these bones starts getting weak after some period of time? How to protect them and what measures should we take? To clear all our doubts, we have Dr. Narayan Karne with us on the topic Happy Bones, Healthier Living. I welcome you, sir.
Thank you. Thank you.
Dr. Narayan Karne is highly trained and specialist doctor who has completed MS and MCH. He has 36 years of experience. He has done MCH Ortho with fellowship in Germany and England. He was throughout topper in academic career and broke university record in first MBBS. He gave more than 350 lectures all over for health awareness to doctors, association and social groups. He had visited about 35 countries and participated in more than 300 national and international conferences and webinars. He has always intended to modify all high-tech modalities to suit a common man. He is the president of Pune Orthopedic Society and secretary and treasurer of Maharashtra Orthopedics Associations, as well as joint secretary, West Zone of Indian Orthopedic Association and chairman, legal committee of Indian Orthopedic Association. He is a executive committee member, IMA Pune and Hospital Board of India, Pune. He is general orthopedic surgeon and has mastery over joint replacement, arthroscopy, spine, complicated trauma, and Elizorov techniques. He has also done research work in yoga for more than 20 years. I welcome you, sir. Sir, I must say you really have very impressive profile. And I'm very sure our audience is also very excited to know more about. So without any further ado, I would like to hand over this session to you.
Thank you. Thank you, Mariya. I'll just share my screen.
Yeah.
Right. So first of all, I thank Raisoni College for giving this opportunity to have an interaction with you. And I have to specifically mention what Mariya, who was has such a tremendous perseverance that it was very difficult for me to spare a time, but she was so much behind me to have this knowledge and everything. I really appreciate her hard work and their perseverance. Now, without wasting much time, because now, just within next 5 days, we have got our annual state conference at Goa, and I'm one of the main in charge of that. But still, it is really a pleasure to have an discussion and the interaction with this august audience. Well, now there are certain misunderstandings about the calcium and the bone and everything. So first, we'll go to the calcium. Why calcium is essential? Actually, calcium is essential for the body, not for the bones, but for the muscles for their contraction. That is very, very important, because if the calcium level goes down, patient can get convulsions. Tetany is a sort of thing, and that is in which the patient cannot breathe and patient can die. So without calcium, patient cannot survive, and that's why there is another part that has got some role in the heart function also, as well as in the blood clotting. That if the calcium is not there, blood will not clot. But before that, person will die of the tetany and the death. So the calcium is absolutely necessary for the body. So it is stored in the bone. So bone is actually go down of the calcium as far as nature is concerned. So nature is using bone as a calcium storage. Now, as I told you, calcium is essential for the survival. So there is a constant demand, continuous demand. The body has to maintain the blood calcium level. Otherwise, then if it goes down, patient can die. So the bone is used as a storehouse. Whenever it is required in the blood, it is taken from the bone. And this regular turnover is there. Whenever some calcium level goes down, it is taken from the bone. And when the calcium level goes up, it is put back into the bone. So it is a regular turnover. It is not a one-time process. That process is going on since birth to the last date or till the death. There is a regular turnover in the bone and the blood and the bone. So body doesn't bother the loss of calcium from bone, because body definitely has got certain natural mechanisms, but body doesn't bother even if all calcium goes from the bone. Rather, body sacrifices the bone strength, that is, sacrifices calcium from the bone to save the person from tetany if the calcium level goes down from the blood. This is very, very important. Now, whenever body requires calcium for the muscle contraction and the heart, it takes from the bone. But if it is not compensated, just because the less intake of the bone, then bone takes the brunt of that, and then they become sparse or the thin. They become weak and fragile. I'll show that actually picture next in the next slides. So what are the effects of the calcium in the now? Body requires calcium, but it takes it from the bone. The bones becoming weak. So what are the different effects? One thing is, in young persons, you can find there is easy fatigability, and they get tired earlier. They get easily stressed out. This is one of the very, very important reason for the young generation who are given targets, and now they are in the jet era with the competitive world, and they require they get easily stressed out. The minuscule part of that is the backache. The osteoporosis or the less calcium in the bones is one of the factor to cause the backache, but it's not the only factor. So if you just take the calcium or vitamin D3, the backache is not going to go up, but it's one of the important one. Then this is the most important, especially in the elderly patients. The bones become so weak that with a minimal trauma, even sometimes even turning in the bed can cause the bone to get fracture. And on top of that, if at all the person gets fracture, there is a problem while doing the fixation of that fracture, because you cannot put the screws or the rods in a very hollow wall. So similarly, in the hollow bones, there is difficulty in fixation, and as well as the healing is very, very, very slow. So how the calcium journey is there in the body, that is the important. So actually diet is the only source. Make the adequate diet is there, then you need not have to take a calcium. You cannot have calcium from other sources. There is a difference between calcium and vitamin D3. I just want to emphasize that and want to clear all the misunderstanding. So source of the calcium is from the diet. From stomach, this calcium goes into the blood. In the normal family, you can say, in the average family, there is never a deficiency of the calcium. So there is no need to have additional calcium supplements in the persons who don't have any diet, any food problem. So when you take but what happens when you take the calcium in the food from the stomach, it has to go to blood. Okay, and it just cannot go to the blood if you don't have the vitamin D. So vitamin D is essential for the calcium journey from the stomach to blood, and from the blood it is deposited into the bone. And even in the bone also, if there is constant turnover going on, there's a leaking of the calcium is going on. So body cannot hold the calcium in the bone if vitamin D is not there. So vitamin D is required for the journey of calcium from stomach to blood, blood to bone, and from bone also it is required for avoid the leaking. So what is important is the vitamin D, and it is necessary for all these steps. So one has to give more stress or the more importance to the vitamin D rather than the calcium. That is for a normal individual. Sometimes in the persons who are having the nutritional issues, there is a dietary calcium deficiencies. In them it is required, but what people think that go on taking the high calcium diet and everything, that then their bones will be normal, it's a myth. So calcium is not important as far as the management is concerned. It's the vitamin D which is important. That problem can occur only in the malnutrition. So it is a really vitamin D deficiency when the bones become weak. So calcium supplementation alone never helps. It is just an adjuvant. The other therapy like vitamin D and further therapy is there. But this is one of the myth which I want to clear from the mind. Now, what happens in the old age? The calcium is lost from the bone. Okay, my body cannot hold the calcium. See, as I told you, calcium old age is also natural process. Calcium loss is also natural process. But it's like a tank. The tank, as becomes old, it starts leaking and it cannot hold the calcium even with the vitamin D also. And there is a leaking. I will give an example of the tank. You know, the tank is like a bone skeletal model, and the water is like a calcium. So the water is stored in the tank. Similarly, it is stored in the tank. In old age, the tank starts leaking. Generally, this is a natural process, but it is compensated with the pouring water into the tank. That is called as the bone formation process, and that is compensated in normal persons. But in the old age, this leaking occurs, and as well as bone formation goes very slow. This compensation goes very slowly. So leaking on one side, leaking is there, on the other side, the water is filled in a much less quantity, and that's why there's a lack of water in the tank, and that is called as osteoporosis. Now what happens? What is the treatment? We can cut down the losses, but this natural process we can't stop completely. But then at least we can make the water sufficient in the tank so that it is useful to us. But if it's unattended, if you don't pay any attention to that, then the whole water drains out, and then there's a water shortage. Similarly, there's a calcium shortage in the bone, and bones they become weak. Why it happens in the old age? In the old age, there are hormonal changes. The changes which are there in the youth are no more there in the body, and that's why these are the ones which are controlling all the calcium metabolism. Especially, it is the parathyroid gland, which is in the neck around with the thyroid gland. That is the one which is very important. So what happens in the old age? Even if you give just vitamin D3, as you can give in young age, if you give in old age, body has to convert vitamin D3 into an active metabolite, and that particular ability is reduced in the old age. So even if you give just vitamin D3 alone, that is not sufficient in the elderly patients. Second thing, even if there is adequate vitamin D3 level in the blood, still body tissues have got the resistance for the action. That means suppose X is required for the young age, for the bone formation, X vitamin D3, 2X or 3X vitamin D3 is required in the elderly age. And now this all process, it starts immediately around menopause in the women. If in women it starts earlier, because what is menopause? Menopause is just a lack of the hormones. The hormones they reduce in the body. Then happens, it starts responding. Yeah. Another part in the old age, it's the weak musculature. Because of the already aging process as well as the less exercises, the musculature becomes very weak, and the activity of the muscle is very important for the strength of the bone. And once the muscles become the weak, the patient they fall also easily, and then they get a fracture. So as I told you, in the old age, the easy fractures as well as they are slow to heal. And again, it is very difficult for us to put the implant inside because implant cannot hold it. Now, what is this? So, what is osteoporosis or the bone loss is nothing but there is a disparity between the bone formation and the bone loss. As I told you, in the tank, the water is going inside and it is draining also. But if there is a disparity, then there is osteoporosis. Now, what happens because of that? If you see this particular bone here, can you see the marker? Yeah.
Yes, sir, it is here.
I will just give a laser pointer also. Here you can find the very thick, these are called as trabeculae, or the sieve-like pattern. There are columns, there are pillars, and the thick, they are also very much thick in this. Okay, so there is a thick as well as thick trabeculae and the densely packed these bones. But in the old age, what happens? In the old age, it is like this. The trabeculae, they become very thin, then they become sparse, they become very weak, and that's why this is known as a very weak bone. So this is a normal bone, this is a weak bone. Now, as I told you, a tank concept. The bones are like a tank, and this water is like a calcium. So it is there in our tank whenever it is required. It is used for the body. So the process of going the calcium into the bone goes on, as well as the leakage also goes on. Now, this particular concept, again, I will go back to that. This what we can do now. There are many things. One, we have to increase the water flow inside, as well as we have to stop the leaking. But there is one more concept we want to emphasize: the size of the tank. Now, whether we can increase the size of the tank? Yes, in young age, we can increase the size of the tank from this to this. Okay, actually bone capacity it increases, but that is only up to the age of 35. Now, this is called as a peak bone mass. The maximum bone mass a one person can have is called as peak bone mass, and they can develop their bone mass. They can increase the size of their tank, but that is only up to the age of 35 years. Okay, and what you have to do, so only up to the age of 35 years, we can make efforts to increase the size of the tank. That is the only maximum bone formation which can occur in any person. Later on, you can just fill up the tank and they empty the tank. Okay, the size never increases after the age of the 35. This peak bone mass never exceeds up to the age of 35. There is a limit of the storage after that. So the treatment of the osteoporosis at the old age starts from the young age. In the young age, you have to do certain things, which I'll come to that later on, which will increase your peak bone mass or increase the size of the tank. Now, there are many things which are dependent, which decide about this peak bone mass. What are those? One is, of course, genetic one. The Western people have got initially quite peak bone mass as compared to the Asian people. In the Asian, the peak bone mass is much less, especially in the Japanese, the peak bone mass is less. That is genetic influence. Then second is nutritional factor. As I told you, if there is a malnutrition in childhood, the bone mass doesn't increase much. Then there are hormonal factor, because certain diseases in the childhood, hormonal diseases, the bone doesn't increase to that much size. And lastly, which is in our hand, is the exercises and the lifestyle in the young age, between the age of say 17 to 35, which decides how much should be the peak bone mass. So everybody should make an attempt right in their young age, in the teenage, to increase their bone mass. Now, the bone loss, again in elderly, what are the certain factors in whom the bone loss occurs earlier than the normal person? So in a thin individuals, it occurs earlier than the normal individual. At the same time, if there is a more than the normal, I won't say weight is different and the fat is different. In a bodybuilder, the weight may be 100 kilogram, like Arnold Schwarzenegger, but there is no fat into that. And especially in a healthy, we can say high socioeconomic lady who is around say 60 kilogram, but her fat may be far more than the muscles. The weight of the bone should be high, the weight of the muscle should be high. So don't pay any attention only to the weight. See how much fat you are having, and the more the fat, the bone loss is more. Then in this jet era, you have to see this thing, that you have to take adequate, inadequate, or irregular sleep can cause the more bone loss. Excessive high protein, excessive, especially the red meat or the mutton. Okay, and this is a high acidic diet. So those persons,
Yes.
especially they say I'm taking non-veg, but if you are taking the beef or the red mutton, that is more detrimental and that can cause bone loss. And in the women, as I told you, it is 5 times more than the men. And in the rural class, where the women are nutritionally deficient, especially in the labor class, the bone loss is quite higher. And the Muslim women, because the veil, they don't get the sunlight, because sunlight is a natural source of vitamin D3. There is that is there everywhere. If you are exposed to the sunlight, then is no need to take the additional one. As I told you, another is the red mutton, and third thing is the less walking. That go less outside the home, and the walking. There is a weight bearing exercises are very much important. So in Muslim women, it is found that the bone loss is more as compared to the other women. Then the most important part in all of individuals, the excessive mind stress. Rather, 80% of the disease, it is my statement that 80% of the disease which you come across are just their origin is more or less with the mind stress or the mental stress. The another part is that for a bone formation, the exercises of the bed bearing, that means walking, running, standing, jogging, these are required. But if you are at one place for a very long time, then the bones, they become weak. So sitting profession, especially the computer professionals, the most of this part, it comes up and they get the early osteoporosis. The other part is the hormonal, which is the main thing which controls all the calcium metabolism, intake, output, everything. So in certain states, like the ovarian hormone deficiency states, that PCOD is one of the very important one, which is coming up now in the young women, and that is one of the reasons why there is a deficiency of the hormone. Then I told you around the menopause, it is not a one stage. Menopause is around the 3 to 4 years period, and there they get the 3 to 5 times more bone loss as compared to the men. So, for example, whatever the men will lose their bone because of the age, in 15 to 20 years, the women, they lose their bone within just 3 to 4 years. So that is a quantum. That's why they should be treated around menopause, even if they don't have any symptom. Again, mental stress, excessive work, and late menarche. If the menarche is a late or the menopause is early, then the osteoporosis is high. And in certain areas, in the especially rural areas, they do the hysterectomy just like tonsillectomy or the appendicectomy. For any problem with the women, the hysterectomy incidence is very high, and that's those women, they get, because the hormones also goes down with that. Actually, hormones are in the ovaries, but the ovary, when the uterus is not there, ovaries, they don't function to that extent. So early hysterectomy can cause osteoporosis. Now, sometimes the drug induced, certain drugs they induce, and the commonest drug which causes thinning of the bone is the steroids, especially for the asthma, for the arthritis, and for kidney and other diseases. They go on taking steroid because that is life saving for them. But then this patient has to be watched for the osteoporosis and should be given additionally bone strengthening medicines and the measures. Then other part is we can see the incidence of the hypothyroidism has increased a lot. That's why those patients, they take L-troxine. But right from the young age, they are taking L-troxine. So those persons also should be taking the calcium and vitamin D3 supplementation therapy. Now there are other drugs like that is a convulsions, anticonvulsant. Phenobarb is a sedative drug. And the anti-neoplastic means the cancer drugs. The drugs which are used for cancer, they can cause the osteoporosis. And the heparin, which is used for thinning of the blood, then there also can cause osteoporosis. Now, what are the investigations which are there to assess how much is the bone loss which has occurred from the person? Actually, the most of the time, the serum calcium is measured. As I told you, even if the serum calcium, even if the bones have lost all of the calcium from their them, still the serum calcium is normal, because if the serum calcium goes down, the person dies. So there is no point in measuring serum calcium. Only when there is one variant of the vitamin D3, that is calcitriol, that is going on, then only we have to see the serum calcium. Otherwise, measuring of the serum calcium is a waste of the money. So what is required, then there's a bone mineral density, or BMD. That also, whatever which is done in the camps, generally BMD camps are there. They are the ultrasound machines, and there the heel bone is used. It is a myth. It should not be done. It is of no use. If at all somebody has to use the bone mineral density, the DEXA machine should be used, little expensive. But then in a normal person, there is no need. What I tell, it is a no use to go for BMD for every person. Every person should receive vitamin D3 and the calcium in young age, and after the age of 50 to 60, that will come to later on, they should be treated for actively. But the bone mineral density, or the BMD, is to be measured only in the secondary osteoporosis, not because of the aging process. So what is required? First, it is spine, hip, or the wrist has to be measured, and not the heel, which is used in the ultrasound. As I told, other marker, there are other marker studies also, which is a higher one, but that is only when you are taking steroids, you are taking cancer drugs, and your bones are becoming weak, and you are giving the treatment. So for that to measure, that is required. But in normal individuals, it is not required. What is important now? It is prevention is always better than the cure. So we have to prevent, stop all those things which cause the osteoporosis. And the commonest is the smoking, alcohol, soft drink. There is a craze of the soft drink. Actually, soft drinks are not at all healthy. Whatever the advertisement, rather government should take the active measures to stop this all soft drinks, because they are dangerous. They are never useful to human being, and rather they are the one which cause precipitation of the calcium in the stomach. Whatever calcium you are taking just goes down the drain. That doesn't go in the blood. And as I told you, red meat, coffee, the excessive coffee, especially in the Western countries, the coffee is very high, and the late nights. These are the main reasons which we use day in, day out, and that is the cause of the loss of the calcium, or loss of calcium intake in the body. So these bad habits, what should be done? Lifestyle modification is required. The bad habits which I just showed you just now, I'm not talking of the drugs and all other things, but these basics also, coffee and the alcohol can cause problem, and smoking. Then adequate and timely sleep is required for that. Then obesity, you have to control the fat in your body. Obesity is a big chapter. It causes problem everywhere. Now, people know that obesity can cause problem for diabetes, blood pressure, heart, and other things, but it can cause problem for our bones as well as for the spine and knees and the heels. Then correct diet. See, all the fancy diet which you see, rather, I always use the extreme statement so that people understand the gravity of that. Anything which is very good for the tongue is not good for the body. That one has to remember. That is general statement. Okay. Then this unstable mind, unhappy mind, greedy mind, running behind all our targets and our aims and objectives, and going high in the sky, taking their feet from the ground. So they don't know when they'll fall down. So you go sky high, you try everything for that, but keep your feet firmly on the ground so that you will not fall down. So try your best to get anything, but whatever you get, be happy with that. That is the important part. And regular exercises as well as proper exercises. What kind of exercise you are doing is also important for osteoporosis. Any exercise, it is just like electricity or the fire. It is essential, but if it is not done in a proper way, it can cause problem. And generally, for certain persons where the things cannot be followed, the certain medicines are there, but I won't say those as the drugs, but this is a wellness medicine. In simple words, they are like a sort of vitamins which help them. It is not like a painkiller. Now, one word about exercises, as I told you, that is very important early in the life. Now, why they are important right from early in the life? One, they contribute to higher peak bone mass. If your tank is already very big, then you can have you don't get the osteoporosis even some of the bone is lost, because once the bone loss is at a particular level, then you start getting effects of the osteoporosis. So if your peak bone mass is high right from the beginning, there is much less chance to get the osteoporosis. because in the rural area, rural women especially, we find right from the age of the 40 years, the one thing is there is no peak bone mass, as well as the all hysterectomy and other things and excessive load, poor diet, they get osteoporosis even at the age of 40. Then what exercises are required? High impact exercise, running, jogging. Impact on the ground has to be there, and resistant exercise against the resistance like weightlifting and other things are required. But swimming alone when there is no impact. In the yoga also, I have my own yoga, but yoga alone will give many things, but it will not strengthen your bones. So along with the yoga, you require some kind of running, jogging exercises, impact exercises. Then in late life, what is important? In late life, the exercises are necessary to improve the muscle functions as the coordination, so that the fall will not be there. Then it delays the loss of independence, as well as it contributes to the quality of the life. So exercise are important. Only thing, the exercise in the young age are different and the old age are different. Now I go back to the diet. Diet is required. Milk and the milk products, yogurt, cheese, there is a high content of the calcium. See, I'm telling again, calcium is different, vitamin D3 is a different. But calcium is required. But only thing, in Marathi we call खात्या पित्या घरामध्ये गरज लागत नाही. It's like that in a well-to-do family, you don't require additional calcium because you get all these things in your diet, like green and leafy vegetables like carrot leaf, drumstick leaves, oily seeds and nuts, sesame seed with the skin. You have to take with the skin, as well as almonds. Fish is an extremely good source of vitamin D3 as well as for the calcium,
Yes.
and the cereals. Then orange juice has got a good amount of the calcium. So these are the basic calcium things which are always there in our diet, but they are required. What is important is the vitamin D3. As I told you, it is essential for all the three steps. Absorption from the stomach, whatever you have taken, whatever calcium you have taken. Now, suppose you put calcium directly into the blood by injection, but still it has to go into the bone. And on top of that, you have to stop the leaking of the calcium from the bone. Vitamin D3 is the most important aspect which has to be taken from day one to last date. So, as I told you, it's required for calcium absorption, bone mineralization, as well as preventing renal excretion. But unfortunately, in diet, the only source is the non-veg, especially the cod liver oil is the highest source of the vitamin D3. So what is the natural source? What a vegetarian person should do? So the sunlight is necessary for natural formation. You have to be exposed to the sunlight. How much? 20 minutes at a time, twice a week. At the maximum exposure of the body, that you should be only on the underwears like you are in the swimming costume. And that also, nowadays it is said that the sunlight between 11 to 2 p.m. is far more important than the morning sunlight. So in this particular period, you have to be there almost a bare and for the 20 minutes. And generally, this is not possible for most of the people because that is their working hours, as well as they can't just sit in the sunlight like that. So what one has to do is to take a oral one. This is a natural one which is there. Okay, so the standing in the sunlight with the all clothes on and for about 5-10 minutes is not sufficient. Now that is one which is called as vitamin D3. But as I told you, as in the old age, this has to be in normal person. This vitamin D3 needs to be converted. Once it is formed in the skin, it goes to the liver as well as the kidney, and then it is converted and then active metabolite of a technical word 125 dihydroxycholecalciferol, or the calciferol is active metabolite that is required for the bone formation. And generally, this process occurs in the liver as well as the kidney. So those people who are having the liver or the kidney diseases, this particular metabolism doesn't occur, and they get, even if you give only vitamin D3, it is not helpful for them. And especially the dark people, if they sit in the sunlight, the melanin which is there, it reduces the ultraviolet action, and this ultraviolet action is required for vitamin D synthesis. And so if the dark people are there, they don't get that much vitamin D3 even if they sit in the sunlight. So we have to take additional supplements for here, especially for the veg people. People ask me, we are veg. I say, no problem. You need not have to go become a non-veg. You can just take an additional external supplement of the calcium, of the vitamin D3. And the most of the city people are not adequately exposed to the sunlight, as well as those people who are having the high risk factor, which I just enumerated. Thin people, obese people, and all those mentally stressed people. This obesity, thin as well as stressed out people, there you can just take one capsule. Initially, it has to be taken every week, but after 2 months, you can take this capsule only once a month. So if you take this capsule only once a month, and there are certain, now the synthetic vitamin D3 there, which is from the veg source also, so they can go for that. But all the veg people, and especially people who don't go in the sunlight, they have to take additional vitamin D3 supplement. And that also once in a month is sufficient. Now, what are the medicines for whom it is required? Apart from vitamin D3, I don't call vitamin D3 as a medicine. I call this a supplement, a nutritional supplement which is necessary. But during menopause, as I told you, the hormones they go up and there is a lot of stress over the bone as well as the heart. And for that, generally in the past, we were giving the HRT, that is hormone replacement therapy, but it has its own complication. So these days, the raloxifene which has come up, and this is very, very important for the postmenopausal women. Now, those women who get the hot flushes, there is raloxifene cannot be given. So there this tibofem is given. But this is necessary for all persons, all women, even if they don't get any symptoms, is required, because once you lose the bone, I told you 3 to 5 times more the bone is lost there. That loss is very difficult to retrieve back again. So all women, generally in India, it starts at the age of 45, 46, but sometimes you can get up to age of 52 also. But in this period, you have to get all these medicines. Then further treatment after that, after the women after the age of 50 and the men in after age of 60, there the bone loss rate is the same after this particular part. So there are good medications which have come up like bisphosphonate, which is there is certain medications which now there is no need to take every day. You can take once in a month, once in a 3 month, once in a year also about the bisphosphonate, and then that lasts for next 1 year. The another best medicine which has come up is the denosumab. It is an injection which is to be taken every 6 months, but that is very expensive. But for a higher class, you can go for denosumab, and for the middle class or the lower class, you can go for bisphosphonate as a routine after 50 years in women and 60 years in the men. Then once the whole tank gets emptied in the severe osteoporosis and patient gets fracture, and especially in the women after 60 years and the men after 70 years, the bone becomes very much hollow if they are not treated before. There is one other injection which has come as a teriparatide. These are injection which need to be taken every day. That is, the person can take just like diabetes. It is like a syringe where the 1 month or even the 40 days stock is there, and you have to just press the button like ball pen. Just like those people who are having diabetic patient, either home, they will understand that they can take self. But it's very important. Teriparatide is the key factor. What I recommend every woman after 60 years to start taking that. There is a big talk on that, but I am just telling you the name. So now what is the take home message? The take home message is build the strong bones when you are still young. So the treatment starts right from even for a wage person, right from the childhood. That is in less than 35 years, you can build the strong bones. And even if you have lost the bones now, you can still recover that after that. But the mass will not be more, but empty tank can be full. So you have to avoid fractures if you don't pay attention to that, and stay fit and healthy when the bones are there. So that is as far as the osteoporosis in the short I have told you. Now there are certain questions asked by Mariya. So I'll go to those questions now.
Okay. Okay, sir. Thank you. Sir, what tools would you expect to use when examining a bone break?
See, there are two different things. Bone break is a bone fracture. Okay. So the most of the time, if X-ray alone is sufficient for the detect the bone fracture, if it is a little bit major one or if it is displaced one. But in a very rare situation, there is just a crack of the bone. So that crack may not be seen by even the digital X-ray also sometimes. So MRI is the best tool to find out the crack in the bone, but it is to be used only when your X-ray appears normal and you are suspecting the fracture. Then MRI is the best tool to use for the bone break, bone fracture.
Yeah.
But if you want to increase, measure the bone strength, then there is a BMD, DEXA scan. BMD is a bone mineral, rather bone mineral deposit. So for that bone strength, you have to go for the bone mineral density. So for that, you have to use the DEXA scan. But as I told you, when you are taking certain drugs, there is certain conditions in which bones are going to become weak. For that, you have to give additional supplement of the bone, and whether that is additional supplement of the vitamin D3, teriparatide, and whether that is working or not, whether that is sufficient or not. To assess that, you can go for DEXA scan. But a routine DEXA scan, I always discourage to go for that.
Okay, okay, thank you. So what is arthritis? Like nowadays, every other person is getting caused by arthritis. So what is the cure of it and what it is?
Actually, I have got a 2 hours lecture on the knee arthritis alone. Means the 1 hour is on all those basic things. But broadly, I can tell you, arthritis, there are different varieties. There is as a osteoporosis. The general arthritis which you find is the aging process. The secondary arthritis, if you have got a fracture or septic or infection or second reasons, then get arthritis, but that is hardly I will say 2 or 3%. Or even the rheumatoid arthritis is the one condition, Sandhivat or Amvat people called as. There you can get degeneration earlier, but basically it is an aging process. The joints, they become aged, just like our tire. It gets smooth, it get all the treads of the tire, we lost the tire, and you get all the the smooth tire. So similarly, our joints also, they lose their cartilage inside, which is like a berry, and they become old, like the oiling goes off inside, and that is called as arthritis. So arthritis is not a disease; it is a natural process. Everybody of us is going to get arthritis. हर एक गाड़ी का टायर स्मूथ होने वाला है, okay? लेकिन if you use that judiciously when it is a new one, so my message is that you, right from the young age, you take the, just like any other machine, you do the proper servicing of the machine when if the machine is new. But at least if the machine becomes old, say at the age of around 40, 45, then at least you should use it properly. So there are 4 or 5 things into that. Number one thing is that for all the arthritis, especially for the rheumatoid one, the heating is very important. If you do the heating, rather with the cold, the bone pains or the joint pain, they increase more. So heating is number one. Number two is the proper exercises. Proper is the word important.
Yeah.
Excessive exercise is the wrong one. Now people are crazy for this Iron Man and everything. It can be done for the perfectly fit person. You are already very much fit, but there is no need to go for 10 kilometer, 20 kilometer. What is sufficient for your body is sufficient. So yoga is for the mind fitness, and the aerobic exercises are for the body fitness. So next is the exercises, and third thing is you have, after the age of 50 or 60, you have to take certain medications to maintain the joints. Those are, I call it, the lubricating medications. The joints are becoming older, so you can take certain medications, which are very new brands of medications have come up. And the last fourth part is that avoid exertion. Now engine is already becoming weak, and if you are using the same as it was you were using 20, 25 years ago, then it's going to get worn out. So wearing out of the joint, worn out joints is called as arthritis, is a general arthritis. So arthritis is not a disease, it is a natural process, but you can maintain. Right now I'm 62 years old. I have got sort of amvat that my joint gets stiff in the morning, but I do initially mobilize my joints, and they can run for 10 to 15 kilometers at this age also. Okay, so that is the way one can maintain their body and avoid
So
arthritis.
no doubt you're looking too fit. Exactly, exactly, sir.
Thank you.
Sir, what is carpal tunnel? What causes carpal tunnel?
Actually, I should have shown it better with the pictures, but now a carpal tunnel is
No, you can show, sir. You can
I
just
can show
show the
you on the
pictures.
net what happens. Okay, I'll
Yeah,
just
yeah,
open the net first, and I'll show you
yeah.
there. Now here you can see this particular picture. Okay, this is a wrist area,
Yeah.
right? The bones in
Yes.
the wrist are called as a carpal bones. So there are 8 carpal bones in that particular wrist. Okay, now this
Okay.
is the front of the wrist, where if you see here, for example, this is the front of the wrist. At the back, there are only bones,
Okay.
flattened bones. But in the front, there is a cup-like picture. Means it is a cup like this. On the back, there are bones,
Yeah.
but on the front, there are tunnels. And from that tunnel, all the structures which are going into the wrist, in the hand, they go from that particular part. Now here you will see here. Okay, this is a part of the thumb and this is a little finger. This particular tunnel is there, and that is above the bone, carpal bone. So it is called as carpal tunnel. Now this particular tunnel is covered by a, you can say, membrane, or we call it as a fascia. So that is a cover to that particular tunnel, and then that
Okay.
becomes a tunnel. So this is called as carpal tunnel actually. Now what happens?
Okay.
There are certain tendons. When I move my finger like this, it is called as a tendons. On the my portion, if you see all these things, this is a tendon. Now similarly, there are tendons which take the finger down, they come from this part. Okay, that's the white you can see
Okay.
here is the tendons. And along with that,
Okay.
the very important nerve which supplies the thumb as well as these 2 fingers and half of this finger, 3.5 fingers, that nerve is known
Mm-hmm.
as median nerve. If you see here the word median nerve, right? Now
Yeah.
this median
Yeah.
nerve, it goes from under the tunnel. Okay, this is basic anatomy now, right? The what happens
Yes.
that the tunnel, it becomes narrow, and because of that, nerve gets compressed. And so it is like
Okay.
a particular fuse. The fuse moves, then the light where it goes, that particular room gets the flickering of the light. So similarly, if something
Okay.
happens to nerve, in the 3.5 fingers, you start getting the numbness or the tingling. Now here, this
Yes.
is the area. It was here. You can see here, this particular area. Here, as I told you, these 3 fingers and the half of the finger. So this is the area which is affected either by the pain or by the numbness. The pain is the initial phase when there is a, it is like a strangulation. The nerve gets strangulation, initially it shouts or the cries, then that is called as a pain. But later on, if that goes on, the strangulation goes on, then the person becomes unconscious, that is called as a numbness. Of course, that if the strangulation continues, it becomes paralyzed, but that doesn't happen in the carpal tunnel. Before that, the patient takes the treatment. So pain and numbness indicates higher compression. Pain is a
Mm-hmm.
less compression. Right. So that is carpal tunnel. If you see here, this is a cross section. This is a cross section. These are the bones on the dorsal side, on the back side. As I told you, these are the
Yeah.
bones. And under this bone on the front side, there is this tunnel. So there are these whites are the tendons. There are tendons are there. And this is the cover of the carpal tunnel, and this nerve gets compressed. Now, why the nerve get compressed? Right. So I told you what is carpal tunnel syndrome. The basic reason is because of the rheumatoid condition or many other reasons. These tendons which you see here, white tendons, they get swollen. And because they get
Yeah. Yeah.
swollen, the area which is right, that the swelling of the tendon causes pressure over the nerves. Okay, and that's why patient gets a problem. So initially the medicines are given to reduce the swelling here, but later on the operation which we do is we cut this cover which is there. Okay, once we cut this cover, even if there is a swelling is there, the nerve doesn't get compressed. So that is called a surgery for the carpal tunnel. Can you see this membrane, carpal ligament? You know, we cut it and we free the nerve. But the main reason is that whatever yellow, whatever blue you are seeing are the tendons. Now, generally, what we do, as I told you, this is a part where you get a problem. And about the surgery,
Yes.
I will show you just one minute. What is surgery?
Yeah.
Okay, we can just find here only or treatment. Right, this is a surgery. We open it, this part, and we cut this cover or the membrane or that is known as carpal fascia. Okay, and these remaining all parts, it is opened up. So even if there is swelling of the tendon, the nerve doesn't get compressed. But in most of my patients, what I do, as I told, probably I have not yet told, but though I am a joint replacement surgeon, spine surgeon, and everything, I try to treat the patient with a non-operative management. And there I have devised many injections or the medicine going directly into the spot. That is injection. Injection, nothing but the medicine itself, but it goes into the spot. So I put the medicine into this because the basic problem of the carpal tunnel is not this tight membrane. It is very rare. Main problem is swelling of this particular tendons which is there. So we put the injection there and reduce the swelling of that tendon. When they don't get, they don't respond to the oral drugs, they respond to this. And in the last 30 years, I have operated hardly 3 or 4 patients of carpal tunnel, but I must have seen more than 500 patients, and all of them, I put an injection inside and I get rid of this particular swelling. So that is called as carpal tunnel.
Great.
It's called as surgery of carpal tunnel, and that is called as a treatment of carpal tunnel. Remaining else, even you
Great.
put a lot of sprints like this, it doesn't help at all. It is just give you temporary relief, but it's not much useful to that because that is like pressing your head for your headache. So that is this brace act. But the cause of why you have got a headache is important, and that can be done only
Yeah.
with the help of medications or the injections. So that is
Yes.
about the carpal tunnel.
Yes, sir. Okay.
So
So
it is
what
actually a big
causes?
topic, but you asked me this, which has nothing to do with the osteoporosis. But
Yeah.
commonly in a carpal tunnel, they give either the splintage, which is not required, then they give the medications, which are sometimes temporary, and then they go for surgery, which is not required. The injection alone can take care of the avoiding surgery of the 99% patients.
Okay. So if carpal tunnel is in initial stage, like just recovered that, yeah, I have something. So can it be cured by exercising or something?
No, no, exercise has nothing to do with carpal tunnel. As I told you, there is swelling of the tendons, which are the moving part. Now,
Yeah.
the Vat Prakruti, which is there, which are not told. In the Vat Prakruti, which you get, these particular patients, they have got a Vat Prakruti. So there is a swelling of the joints, tendons, and everywhere, muscles.
Okay.
So these can be taken care by hitting first thing. Hitting is important. Second thing, you have to take certain painkiller to reduce the swelling. And if
Okay.
you do the exercises, stretch exercises
Yeah.
for regularly, then it can help to reduce the swelling. But if it goes beyond a certain limit, if the swelling goes beyond certain limit, exercise alone is not sufficient. Then you have to take this medication either orally or in the injectable form in the wrist itself. And then for the further prevention, because in the Vat Prakriti patient, they have a tendency in the rainy season, suddenly the body becomes stiff as well as there is swelling of the joints. In the cold season also that happens. And in the summer season, if they sleep under the fan or sit under the fan for a long time, they get this problem. So prevention is all these things: heating, then if required medication, and then stretching exercises. Those tendons, if the stretching is done like this particular part, not this. Initially, if you do like this, there is a stretching in this part, and these tendons, they go up to the finger. So if you stretch more like this, the only thing is you have to hold as much as you can. You cannot injure yourself. So in this condition, you hold it for some time, do few breaths, around 10 breaths, and then leave it. And give the heating to this particular part. Heating and these exercises will take care of most of the part of the carpal tunnel. Then if it doesn't relieve by this, then other things.
Okay.
Hello?
Yeah. Sir, my next question is, what causes knee pain and how to cure it? Because nowadays knee pains are really very common in old ages.
Exactly. So the knee pain in a young age is different in an elderly person. As I told you, osteoporosis is one of the part, but there are certain aging processes which everybody has to go through that. Like a worn out machine or a worn out car. You see at any part, the tire is gets smooth, the battery gets down, the engine doesn't get pick up. Everywhere there is a problem. So people are aware of the issues of the old age, like a diabetes, blood pressure, and hypertension, but they are not aware of the other parts. That is in orthopedics, there are 4 areas in which you get the more effect of the wearing out. So one is a knee, as you just told me. Second is the back. Third is the neck, backache and neck pain, and last is osteoporosis or the bones weakness. So the knee is one of the very, very important part, especially in Indian conditions. They get worn out faster. As in the rural area, if the roads are bad, the tire gets worn out earlier. So similarly, in Indian condition, our culture is a floor sitting culture, especially in rural areas. The women, they do all their work in a squatting position or in the sitting position. That's why their knees get fired earlier. So the knee is a joint which gets stress maximum, and it's like that in a road where the roads are bad, the left side tire gets worn out earlier than the right side because that leaves the road every time. Similarly, knee is the one which gets knee pain. So in younger age, the results are different. Commonest reason in younger age is the trauma, any twisting injury, especially the twisting injury for the knee, not direct hitting injury. That happens when you are dancing, when you are, fall from the bike, or even while getting up or while descending or climbing fast on the stairs, then you can get twisted, and that twisting injury is common in young age. Second common reason in the young age is the rheumatoid arthritis or the VAT. Rheumatoid arthritis or the amuvat, sort of those things where multiple joint gets involved. But as you asked me in the old age, what I say, everybody is going to get the knee pain. All tires are going to get worn out, but it depends how you are taking care. If you are taking earlier when the tire is new, that is before they are 40 years, your knee can last longer. I gave you my own example. And we have operated the patient at the age of 50, 60 years. We operate only when the tire get burst. We don't operate 99%. Again, patients of knee pain, I don't operate them. But as I told you, first I give injections. That is this tube or tire gets punctured. So we put the patch on the puncture, but we teach them how to save that particular tire and use it judiciously so that it won't get worn out earlier. So knee pain in the elderly, everybody is going to get the pain. If your pain doesn't come, again, same with the heating or with the proper exercises. Now here, the exercises are called the range of movement exercises. In old age, your knee should move down, in and up like this. Okay. But when you're sitting on the ground and you're getting up, when you're sitting on the ground, then it becomes like this. And when you get up, then it becomes straight. But in this, you are lifting whole of your body weight. So all these patients who are having knee pain should not sit on the ground, should not sit cross-legged, should not squat, and sit in Vajrasana, especially for the namaz which is done, where they have got difficulty in sitting there, like sort of in Vajrasana. So all these of the knee should be avoided up to the age of 50 in women and 60 in men. So because that will wear out earlier. So knee pain is going, summarize the knee pain. Initially, you should try to save your knee as much as possible, just like any machine. And all these things should be followed. And the care of the knee joint is do the heating, do the range of movement exercises, movements like a yoga. Third thing is
Yes.
take certain medications which increase the life of the knee joint. And fourth thing,
Yeah.
avoid excessive wearing out. And if at all the tire gets burst, then you have to change it. So replacement is a very good surgery, but it is an abuse. For every small puncture also they are changing the tires now, even if the puncture is there. But we say, okay, you can change the tire, but if the new tire is there, again after 4 to 5 years it can get puncture, then people change it again. So replacement is not the end surgery. You can do the replacement only as a last resort, but maximum attempt has to be made to save the joint.
Okay. Okay, sir. So what precautions should be taken to prevent the reduction of calcium in bones? And what is the reason for reduction?
Just I gave all the lecture why the bone
Yeah.
loss is there and what it should be done to prevent the bone loss. As if the bone loss at all has happened, how to regain it back. The whole lecture was on that. There are further 3 questions
Yeah.
there. They already have been addressed in my initial talk.
Yes, sir. Sir, in market, calcium tablets and drinks like Horlicks and all that are available. So, should we really consume it for restoring the calcium to bones? Is it really helpful?
That is a really very, very, very important question. Because if you see the advertisements we are going on, especially I get the opportunity to watch the TV channels only after 11 or 12 o'clock in the night. And most of the 50% channels are showing all these liniments, oils, all these things which will cure your joint pain and the knee pain and all the bones things. As I
Yeah.
told you, even if the proper diet is there and if you are taking adequate precautions and supplements, maximum you can have a vitamin D3. One thing is calcium is not required in a normal healthy family. It is not required. All this is a humbug. It's like that heroine you tells us, दूध की सफेदी निर्मा से आती है. That heroine might not have touched the nirma at all, but she's telling use the nirma, so you are आपके कपड़ों को दूध की सफेदी आएगी. So don't fall prey to the advertisement. Number one, whatever is available in the advertisement, let it be protein powder or any liniment, cream, gel, or even calcium supplements, they are available at the 10% of the price they are quoting you there on that. So don't fall prey to any of the advertisement. Have your normal diet. Stop all these bad things. If you are taking all these higher end, expensive advertised things, and you are having the soft drink to get the power which the Salman heroes they get after having the soft drink, then you are going to lose your strength.
Yes.
So don't fall prey to any of the advertisement. One advertisement cost 1 lakh rupees almost for 1 minute. And when they're spending so much money, where they are going to recover it? So the cheaper and better options are available. That most of these are in your diet. And if at all you require medicine, quite cheaper medicines and the protein and calcium and vitamin D supplements are available. Don't fall to any of the advertisement. Not for even the knee pain, also for the back pain, also, and for anything. But if you see the things people are falling prey to that. That's why there are huge number of the channels which are showing all these things. That is a pathetic situation, actually. Very sad. They are misguiding the people.
Okay. Okay, sir. Sir, thank you so much for this wonderful and comprehensive and detailed presentation on bones given by you. And so thank you so much for your advice on giving that advertisement thing. So it was really a good session, an informative session. It was a pleasure for us to have you, sir. Thank you so much, sir, for your time. It was really helpful for us.
Thank you very much. Same here.